I'm a third-year medical student on my OB/GYN rotation, and I'm attending to a baby's birth. The mom is lying on the bed, her husband is at her side, and the obstetrician is at the bottom of the table. The baby has just been born. The doctor places the baby on the mom's chest, and the husband has kind of an odd look to his face. He looks down at the doctor as he's performing the episiotomy repair, as he is very gently suturing her torn tissues back together down there. Instead of paying attention to the baby and the mom, the husband walks down to the end of the table and whispers into the doctor's ear, "Hey doc, she looks kind of stretched out down there. Can you put a stitch in for me?" For you? What the fuck? After being in the medical profession for over 28 years, I have heard some of the dumbest things said by husbands and boyfriends. On this video, I'm going to share with you 3 more of the absolute most ridiculous things I've heard as a plastic surgeon and physician. One of my most popular operations is breast augmentation surgery. I do about 50 to 100 of them a year, and so I see a lot of consultations for this operation. Sometimes the patients will come by themselves, other times they will bring their husbands or their boyfriends, or God knows what the relationship is. I've had many female patients who've come in and their husbands or boyfriends have disagreed with them on size. Now, this is a very common story. I hear this all the time in my office, but I once had a young woman come to see me for breast augmentation. She was an A cup and wanted to be a B cup. She was accompanied by her boyfriend, who took a lot of interest in the consultation. He asked a ton of questions, gave his opinion quite often on what implants should be used, what incision should be used, and whether the implant should potentially go above or under the muscle. This is not so uncommon, but it was something that he said afterwards that really pissed me off. She said, "Dr. Youn, I think I've decided on a 300cc implant." So I replied to her, "I think that's a great size for you. It's going to give you that big B to small C that you're asking for." Well, her boyfriend did not seem too pleased with her final size decision, so he nudged her and then whispered in her ear, "Come on, baby, go bigger with the implants. You know I like them big." "Oh, you like them big, don't you? Then why are you so small down there?" Well, guys making decisions about their significant other's bodies doesn't just end there with some of the stupid things that I hear. I recently had a woman who came to see me for a consultation for a tummy tuck. She had 2 children in the past, so we talked about a tummy tuck as a way to get rid of the excess skin that was hanging from her tummy that really caused her a lot of distress. After going through the operation details, I told her that it's going to take about 2 weeks for her to really feel good and to do pretty much whatever she wanted to do other than exercising. And she replied to me by asking me, "Dr. Youn, so I'm not going to be able to take care of my children for the first week or 2? So I told her that usually patients have their spouse or their family member help them at least during that first week when they have small kids. Now, her husband has been sitting with her throughout the whole consultation and didn't say a word the entire time. In fact, he was actually looking at his phone most of the time, and when I look over at his phone, it was pretty obvious that he was scrolling Instagram. After I confirmed that she'll need help taking care of her children in that first week or 2, her husband finally chimed in, and this is what he said. "Babe, if you can't take care of the baby, who's going to take care of him while you're recovering from your tummy tuck?" Who's going to cover? You dummy. Would you like to look 5 or 10 years younger, but you don't want to go under the knife or needle? Well, what if I told you that you could use your body's own natural regenerative abilities to turn back the clock in a major way? It's a process called autojuvenation, and it's the culmination of 20 years of me being a holistic plastic surgeon. I reveal this groundbreaking approach in my new book, Younger for Life. In this step-by-step guide, I show you how, through simple changes in diet, activity, and skincare, you can reap huge changes in your skin and look younger than ever before. Best practices for sleep, exercise, luxurious thick hair, beautiful teeth, and mindset. And a simple 3-week program to jumpstart your autojuvenation process to look and feel amazing. Why wait to turn back the clock? Please order Younger for Life at autojuvenation.com. The link is in the caption below. Well, sometimes it's not in the consultation room where the husband or the boyfriend really sticks their foot in their mouth. Other times, it's actually right before surgery. I once had a patient scheduled for breast augmentation surgery, and she took a lot of time choosing her implants. She was a large A cup and wanted to be a C cup and had decided on implants that were 325 cc's. So after I marked her in the preoperative area, the anesthesiologist and the operating room nurse wheeled her gurney into the operating room. As I started walking to the operating room, her husband took me aside and he said, "Hey, Dr. Youn, I know she decided on 325 cc's. What do you think, just between you and I, you add another 100 cc's in her? How about a 425? Yes, he actually said this to me while she was being wheeled into the operating room, and he wanted me to change her size without getting her permission. So these are just a few of the dumbest things that husbands and boyfriends have said to me over the years. There is so much more that I'd love to share with you. Leave me a note in the comments if you want to hear more of these in another video. But if you like this format, I've recently posted some videos about some of the craziest things that have happened to me and my patients over the years. These are stories that will absolutely blow your mind. Take a peek at them right up here. And remember, eat real food, use clean skincare, and auto-juvenate before you operate.